Welcome back. New now. If you are like most people, chances are you're planning to tackle a New Year's resolution. So this week we're hoping to help you get on the right track with advice from experts and people who have already found success. Before we get there, though, Nicole Mischke has a look at why so many people fail at accomplishing resolutions.
Few people can actually say they've completed a New Year's resolution, and one of the reasons is because many of us don't realize that to change the things on the outside of our lives, it has to start on the inside.
All of these external approaches to change, unfortunately, aren't sustainable, and that's because the driver for why it's not happening is not understood.
Dr. Michelle Estelle is a practicing psychologist who knows we could all benefit from working on our mental health and that it shouldn't be seen as something negative.
It's not a stigma. It doesn't mean necessarily that something's terribly wrong. Just like saying I need to watch my nutrition doesn't mean I'm ill. It just means that I can optimize my health.
And a healthier mental state can lead to an overall healthier life. But getting to that healthy place starts by first recognizing the symptoms that show we have room to improve.
I feel stressed. I get angry when little things happen. I'm having trouble sleeping. I kind of have this down feeling. Nothing seems that fun. But these people who have report those symptoms are in the job, doing just fine, parenting just fine. You know, everything is just okay, but not great. And what we want is great.
So how do we get to great? Well, Dr. Estelle says you start by answering these questions. What are my needs? When am I at my best? Is my life in balance? And we must all try to understand the cause of our negative behaviors.
A typical one is, people want to lose weight in the new year or, exercise more or something. It's tempting to have a very kind of a perfectionistic or critical perspective on that. So as opposed to just setting up some sort of external thing, I would want the person to maybe spend a little more time trying to understand why it's there.
To do this, Dr. Estelle recommends setting aside just 10 minutes a day to meditate. It sounds like something so small, but the results...
It's actually quite dramatic, and I feel like I have more grounding. I'm just more calm. And I feel like I handle stress a bit better. And then I'm also seeing that in my patients.
If you've never meditated before and aren't quite sure how, Dr. Estelle recommends an app called Headspace. It offers guided breathing and meditation exercises, and it's super user-friendly. And if you'd like to hear Dr. Estelle expand more on this topic, you can head to my Facebook page. Nicole Mischke for KHQ Local News.